My name's Mark Stainton and I'm the Director of Adult Social Care and Health at East Sussex County Council. We've invited you along today so that you can hear firsthand what local people who need care and support and their unpaid carers and families have had to say about what's important to live a good life. We've gathered this information through surveys, focus groups, interviews, and other pieces of evidence and research. Thanks to many of you, we've been able to reach a range of different stakeholders, including seldom heard groups who aren't already accessing services. You'll hear more about the 6 priorities coming out of the engagement work shortly, but I wanted to stress how crucial it is that our adult social care strategy is led by what is important to people who need care and support. I know that there are a number of challenges facing adult social care and our partners at this time in terms of resources, but I think that this makes it all the more important that we focus on which aspects of services make the most difference to people's lives, build on their strengths, and deliver the best outcomes. I hope this strategy will provide a clear sense of direction for staff, services and stakeholders, and help them work together to achieve our shared goals. The strategy has the potential to enable people to see at a glance what they might expect from us, as it describes adult social care in terms that are meaningful to residents. The strategy will become the scaffolding for developing long-term plans and local support, helping us to be clearer about what we do and how we do things, being forward-thinking and less reactive. We know that it can't answer everyone's questions about services, and we know it can't be as precise as we would want it to be, given that we operate in a world of funding and resource constraints and uncertainty around government plans for social care reform. But in publishing our strategy this summer, we hope that we're helping to shape a future which enables everyone in East Sussex to live their best lives. You are part of making this happen, and I know that you'll carefully consider how we might build on services and support that are already there, or indeed how we might change things. In other words, you'll think about what we should do differently, as well as what we should continue doing to help people to live well and maintain sustainable services. I'll hand back now to our chair today, Sam Williams, our Assistant Director of Strategy, Commissioning and Supply Management, and I hope that you'll find the workshop useful and thought-provoking.